So, welcome back, guys, to the Ivy Cancer Podcast. And today we have a visitor in the house, Dr. Jackie Holliday Bell.
That's right.
Welcome to the Ivy Cancer Podcast.
Thank you. Good morning, everybody.
Okay, all right. So, before we get into the meat of the matter,
Sure.
I would like you to give us a brief snaps about yourself and just a little history about Jackie.
Okay. So I was born in Birmingham. My parents came over from the Caribbean, two islands, specifically Montserrat and St. Kitts Nevis. They came in the late 1950s, called back to the motherland after the Second World War. So they settled in Birmingham, got jobs in factories. My mum went on to train as a nurse. My dad went on to train as an electrician. I went to school I was born in Birmingham, went to school in Birmingham, and decided I wanted to become a doctor. It was a bit strange because I was quite good at a few different things at school. I was young, I was healthy, and I enjoyed running, singing, dancing, playing musical instruments. In fact, I met you because I was playing my musical instrument, wasn't I? I was playing in church.
What was that musical instrument?
It's a soprano saxophone,
Soprano,
yeah.
okay.
So it's a long straight saxophone. It looks a bit like a clarinet, but it's made of brass.
Yeah.
And you'll remember, I think Kenny G is one of the famous people that plays
Yeah,
it.
okay.
So it's quite a high pitched saxophone. It's not the sort of low bass ones.
Okay.
But yeah, so studied at school, did okay, did well in fact, and then decided I wanted to become a doctor. So I'm now sort of 13 years oldish. I'm telling my teachers at school that that's what I want to do, and they say, no, you're good at music, you're good at running, just stick with those things. You're not going to become a doctor. So that made me think, hang on a minute, why are they saying that? I'm still young, I've still got my potential. So I really just dug my heels in, studied, and got into medical school. I studied at Leicester, and I was there for 6 years. I had the opportunity to do an extra degree because if you go to medical school, they give you an option of they call it an intercalated degree. So you do a degree in 1 year, and I did the neuropsychology of left-handedness. It's a bit strange, but it's something that interested me, and so I got an extra degree. I then went on to marry my husband Duran, who's here supporting me today. Shout out to Duran.
Give thanks.
And give thanks, yes. And became a GP. So I didn't marry straight after medical school, sorry. Studied as a GP first and qualified, married Duran, and then I went into a field called occupational medicine. But I think we're going to come on to that a little
We'll
later.
definitely get onto that. But at 13, you knew you wanted to be a doctor.
Yeah.
What gives you that passion to wanting to be a doctor at 13?
At 13. So I think I was interested in the sciences. I was interested in biology. I was interested in health. Thankfully, we hadn't experienced a lot of ill health in the family. But, you sort of, I think I saw a little bit on television. Television wasn't then what it is today. You had a limited number of channels. It turned off at about 10 p.m. But I think, and my aunt was a nurse. My auntie was a nurse. She's passed away now. My mother's passed as well.
I'm
Sorry I'm sorry about your mum passing.
Yeah.
So I heard it was the anniversary
Yeah,
yesterday.
yesterday was the
So
anniversary.
my condolences. It's a very, very significant loss when your mum passes.
Yeah, and especially
Yes.
I was the only child for my mom.
Oh, you're the only child. Okay.
Yeah.
Yeah.
Yeah, so
Wow,
we had that
yeah.
bond.
Mother and son bond is very strong, isn't it?
Yeah,
It's
and she
amazing.
was basically the mother
She's the
and the
rock.
father.
Yeah, and she was your rock.
She
yeah.
was my everything.
Yeah, I can imagine.
Trust me.
She loved you with, unconditionally, and you loved her unconditionally. I can imagine. Well, I was one of four, and I was child number 3. And my aunt, who lived in America, was a nurse anaesthetist. So in America, they allow nurses to put patients to sleep for surgery.
Okay.
And she was a clever girl, a clever young woman, my auntie. And I think she also encouraged me to think about medicine. So at first I was thinking of nursing.
Okay.
And then they said, no, go for medicine. So I started opening my mind to medicine, picking up extra textbooks at the library. You didn't have the internet. You had to walk,
To the library.
for half an hour to the library, check on the shelves for the books, and then read the books. If you could take them home, you could. If some of them were reference books, you had to leave them on the shelf. But yeah, so through reading those books, I got more understanding of human biology
Yeah.
and also medicine. I remember getting a textbook. It was like a simplified medical textbook, but I remember reading it from cover to cover and making notes. So yeah, that kind of stimulated my mind to understand more from a young age.
Okay, that's brilliant. Because I can imagine, walking a few miles to go to the library, comparing to now, it's just totally different.
Totally different.
Yeah. So you study science and the human
Biology, chemistry, mathematics, physics. Yeah.
Before we get into further, this topic, this podcast is mainly about cancer and health.
That's right.
I want to spread cancer awareness and how can we, better our health, to prevent all of these sicknesses.
Yeah.
So I want to start by asking you, do you mind telling us what is cancer and what how cancer starts?
Sure. Yeah. Well, before I go any further, I do want to say that I've always been a Christian, and it was God that gave me the strength and encouragement and the foresight to work as hard as I did.
Yeah.
He gave me the brain that I have and the body that I have, and I give God thanks for all of that.
Definitely.
So your question was about cancer diagnosis. Cancer.
What is cancer, basically?
What is cancer? Okay. Yeah. So cancer is an irregular mutation of cells in the body. So we have millions of cells, and they're differentiated according to which organ they are part of. Right. When you think of the embryo inside the woman's womb, you were once the embryo, I was once the embryo. Yeah. That embryo starts off as just one cell. Right. It splits into two, splits into four, and then it continues to multiply. Then the cells organize themselves to become the brain, the liver, the kidney, the lungs, the bones. Isn't it amazing what God has done?
Definitely.
So, but ultimately, even from the time we are conceived, there is a risk of cancer. So it's where the cells mutate. The DNA in the cells basically changes from what it was naturally to something abnormal. And with some of those mutations, it can lead to an irregular development of cells which are not for the body, they're against the body, they're cancer cells. So cancer is a cell that has no function, and it's actually aiming at destroying tissues and potentially can spread around the body and lead to death, unfortunately. So I hope I've given a simplified description of what cancer is.
You definitely did, because what's funny is since my mom passed and I've been doing watching podcasts, listening to doctors, I think I got a better insight now from you what cancer actually is, because when they explain what cancer is, they're just basically saying it's a mutations of the cell, etc. But you had said that from the very moment that we were conceived, we have a risk of cancer.
Yes, you are. And can I just say a little bit, because one of the parts of my research was actually looking at pregnancy outcomes. Right. And so that we go to work and we're exposed to various hazards, and this is my area of work, specialism. Some of the things that we're exposed to at work can increase the risk of cancer.
Work.
So yes, so even the man or the woman who is, before they even conceive a child, they're exposed to elements in the workplace which can cause cancer. Okay. So an employer, you go to work, you go to do a job, you go to earn money to pay your bills. Your employer has a duty to take care of you at work by law in this country.
Right.
Now, we're quite good in the UK and parts of Europe, but in other parts of the world, people are exposed to things that are very dangerous for their health. And even here, there is some dangers, but your employer is meant to put in place some safeguards to protect your health.
That is in my
later. Yeah.
But it's so interesting that you said that our parents were put at risk doing the job that depending on the job that they done.
Yeah, and we are put at risk.
Yeah.
Even as a doctor, I'm put at risk. You're put at risk.
Yeah.
The lollipop lady who's crossing the children across the road, she's put at risk. Environmental, chemical, carcinogens, moving and handling, stress, night work.
Yeah. as you speak about work and you
Yes.
speak about stress.
Yes.
There's a family member, not family per se, because I don't call my TikTok followers followers. I call them family.
It's nice.
And there's this person on the program now. Her name is Casey.
Okay. Hi, Casey.
She got diagnosed with breast cancer twice.
Wow, sorry to hear
The
that.
first time was work related. She
Really?
done night shift.
Okay.
So it's funny how you said that.
Yeah.
You know, and also stress.
Yes.
So stress in every way pertaining to the night, the body, the mind, it affects us and gives us a risk of cancer.
Yes, that has been found. And when I first started in this field, we weren't sure.
Yeah.
But there has been research now. We look at the specific research looking at what things in work cause cancer. And night work has been associated with cancer, particularly cancer of the breast.
Yeah.
And also to some extent the gut as well.
Yeah. So in your field of work, you advise employers about fitness and to start a job,
Absolutely.
fitness and to return.
Absolutely.
You know, how can having cancer affect our work, and what advice would you give someone that living with cancer and depending on their job to provide for their daily needs?
Okay. So I do a lot of stuff. I don't just deal with cancer, to be honest. So
Definitely.
I had to sort of revise my knowledge about cancer because, again, although I dealt with a couple of cancer patients just this very last week, it's not every day.
Right.
So there's evidence that shows that the cancer burden due to workplace exposures actually in the UK is about 5%. So that's interesting, isn't it? The cancer burden due to workplace exposure, so people exposed,
Right.
this is what we were saying earlier,
Right.
is 5%. And I believe that between the ages of 20 and 64 years, there's over 121,000 people for non-work related cancers who, the incidence, so the number of new cases is 121,000 per year in the UK.
Right. That's a lot.
It is a lot.
Very lot.
Yeah. That's new cases, This is not people who've already had it and are being treated. This is new cases. And we think there's only 365 days in a year.
Yeah.
I haven't worked it out, but that's a lot of people
That's
every
a lot.
day
That's a lot.
who are being diagnosed with cancer.
Yeah, that's a lot.
Yeah.
I was doing my research. It says that over 4,000 persons, new cases, been diagnosed of cancer every minute
In the
in the UK.
I haven't divided it down, but it's 121,000
Yeah.
divided by 365. I know if one of our assistants can help us with that, just so that we get a comparison.
Yeah.
Because with research, it's not an exact science.
Right.
You will look at research papers, even in your own field,
Yeah.
your own research for your blogs, and you will find that one paper will say one thing, and a different paper will say something different, and it depends on how the research is undertaken.
Oh, okay.
Have we got a figure? Yeah, is that 331?
200.
Is that what you said?
Something like that. No,
Yeah.
it was 4,000, but maybe I missed
Per day?
the calculation.
Yeah.
So it's about.
Well, that's
200.
new cases, yeah.
That's
So
new cases.
per day.
Per
so,
minute.
and per minute, we'd have to divide that by how many minutes there are in a day.
Yeah.
That's per day. But anyway, so in the UK,
Mm-hmm.
England, Scotland, and Wales, Northern Ireland,
Yeah.
there's 121,000, and most people survive more than 10 years.
Right.
50%, and 5 years, 82% for children. Because don't forget, it's not just adults; we're talking about
Adults,
children as well. And that's why I mentioned the womb, because some children come out with that potential to develop cancer, and they get leukemias, don't they?
Right.
They get cancers of the brain, cancer of the eye, and so forth.
Right.
We hear about these cases in the news.
Yeah.
It's not because they come out and started smoking cigarettes.
No.
There's something in their DNA that had already been mutated
Right.
that led to them developing the cancer from an early stage.
And obviously that comes from the parent, the mother.
Potentially the parents.
Yeah.
Yes, and there's so much we don't know because there's so many chemicals in our environment
Right.
that we thought were acceptable.
Right.
Even asbestos at one point was thought to be acceptable,
Right.
and now we know it's very dangerous. But yeah, and there are cancer families. There are some families which
I honestly think that cancer runs in my family.
Yeah,
That's for
okay.
sure.
Yeah,
Because since my mom passed, I found out that several persons in my family on my mom's side had cancer or die of cancer.
So do you.
So it can be a genetic thing.
Yes, there
as
is.
well.
There seems to be, we call them cancer families.
Right.
So one might have breast, one might have esophagus, one might have lung.
Right.
But it seems that or bowel, you know.
Right.
It seems in some families there seems to be more cancer than in other families.
Right.
So your question was about. So sorry, I
How
got.
could you advise
Okay.
someone with in your field of work, it's not just cancer,
No, it
but
isn't.
long-term illnesses.
Okay. Yes, that's right. Yeah.
How could you advise someone that depending on their job
Yes.
to provide their daily need, what
Okay.
kind of advice you would give them as it relates to fitness and work?
Okay. So most of us start work in either from the age of 16, maybe 20. I started at 24.
Yeah.
We start work around that time. And when we start off, most of us are healthy.
Right.
There's a few, as you know, that would have cancer or long-term conditions.
Right.
Cystic fibrosis, asthma, epilepsy. So when you join the job these days, they ask you to complete a pre-employment questionnaire. They ask you to declare if you have any pre-existing medical conditions, because those conditions could affect how you do the job, whether you're safe to do the job, and whether the job causes a risk to you.
But 1 second.
So, yeah.
Could that affect you from getting the job?
Potentially, yes, if on the balance of probabilities, there's a safety risk to you or your colleagues.
Okay.
So if you are an epileptic and it's poorly controlled, just give you one example, and you're required to work at height,
Right.
you may have a seizure, and it has happened,
Yeah.
and fall.
Someone for.
And you guess what? You might fall on top of somebody else.
Yeah.
So you're not just putting yourself at risk, you're putting other people at risk.
Right.
So if on the balance of probabilities, the health and safety risk outweighs the the needs of the employee, the person that wants to work, they can tell you you're not fit for a job. And that's my job. It's very rare because we have a piece of law called the Equality Act. It came out in 2010.
Equality Act.
Yeah, and I will say straight up that every single person diagnosed with cancer falls under the Equality Act from the day of diagnosis. This means that they should be treated fairly and with support and with adjustments as far as is reasonably practicable.
Okay.
So if you go for a job and you have a diagnosis of cancer, anybody has, the employer should take into consideration what adjustments they can make. The epileptic also qualifies. So if he can't work at height, ideally he or she should be given an opportunity to work in an alternative job which is safe.
Okay. With that said, Casey, the same person that been diagnosed with breast cancer twice.
Mm-hmm.
She recently lost her job.
Okay.
She was forced
Okay.
to resign, and one of the reason why she was forced to resign is because she didn't disclose that she had cancer.
Yeah.
Do the employer have the right to do that?
Very, very good question. In fact, I was surprised to read just in my research to prepare for this that 50% of people don't tell their employer that they've got cancer, which I was a bit surprised about.
Mm-hmm.
So, you're in a contractual arrangement. You spend 70% of your waking hours at work,
70%.
70% of your waking time is at work. So
Break down that for us.
So you spend a lot of time at work.
Yeah.
They know you.
Right.
They know you better than sometimes your neighbour knows you,
Oh, okay.
So we have to almost have a two-way relationship with them.
Right.
We have to be kind of open with them ideally, but you do have the right to confidentiality. If you don't want them to know something, you have a right, but unfortunately it can have drawbacks.
Okay.
If they had known, they would have a responsibility to her from the day she told them.
Right.
Because she qualifies under this Equality Act.
Right.
They should support her with a number of things, which I can talk about now or we can talk about later.
Yeah, we can get into it.
Yeah. So they should give her time to go to appointments.
Right.
If she has to go every Monday and Friday to a clinic, or whichever clinic, wherever it is, they should give her time.
Right.
So if her schedule would normally mean she works on a Monday and Friday, they should give her that day off. And potentially even still pay her, depending on your contract.
Okay.
They should give her time for sick absence. So let's say she's had the surgery and she's recovering. She may need a number of weeks to recover from that surgery.
Right.
She's entitled to sick absence. And again, she should be entitled to quite a bit of pay.
Right.
The public sector, working for the NHS or the civil service, they have an amazing sickness absence package.
Right.
It may not be the best paid job, but it pays. They protect their workers in terms of you can have 6 months of full pay, and 6 months of half pay.
Right.
Yes. So essentially, you can stay off work for 9 months and still get most of your pay.
Hey.
So, but in private sector, so for example, you said you work in a warehouse.
Right.
That's probably private. They will have less generous sickness absence arrangements. So they will give time off work, sickness absence, and they may make adjustments when she comes back to work. So let's say her job involved heavy lifting and she couldn't do that,
Right.
or nights, for example. They can make adjustments, that they should make changes to the system of work to allow that person to come back into it. Because after looking after your family and your own well-being, work is a very important part of someone's identity.
Definitely.
Yeah. So we recognise that coming back to work, if you can come back, and many people do come back, breast cancer survivors do come back to work if they get the right treatment and so forth. So coming back to it would have been a very important aspect for Casey and anyone else suffering with this kind of condition.
Unfortunately, Casey, she's from Jamaica, so
Yes.
I'm not certain what the rules applies in Jamaica, but I'm certainly, here in the UK, people could get some knowledge from that.
Yes.
But, someone asks statutory pay. Would that be the same as statutory pay?
Statutory sick pay, yes.
Oh, okay.
It's different actually, because there's an employer's sick pay and then there's statutory pay, which the government contribute to as well.
Okay.
When you run out of your employer's sick pay.
So how long within that term, let's say an employer is allowed to pay you comparing to the government?
Okay. Well, I will admit I don't know the exact figures on this. I'll be honest, but everybody's contract differs, and as I say, the public,
Okay.
So the public service and the civil service, they have the best arrangement,
Okay.
and that was the 9 months I talked to you about. But a private, a private sector will have a different arrangement, and when you go into work, you sign a contract,
Right.
and in that contract there'll be a section on sick absence and sick pay. So I just encourage anyone that's taking up a new job just to read the contract carefully, because I know that some people are not covered if they go off sick within like the first 4 weeks. They get no pay, or 6 weeks, or whatever it might be. They get no pay. You see, sickness absence is actually a very big thing in the UK, where we lose billions of pounds every year because people are sick.
Right.
But we won't go into that in too much detail now.
Yeah.
So my advice is only that, so when they come back, when they come back to work, they can come back on a phased basis. So let's say your job is 40 hours a week. When you're coming back from a cancer, treatment, you're going to feel a lot of side effects. You're going to be in pain. You may have fatigue. You may be experiencing side effects of the medication, the chemotherapy, the radiotherapy. You may not be sleeping well at night.
Which I've learned a lot
Yes.
about that.
Yeah. These are the things that happen. So you cannot be expected to come back in and work your full 40 hours.
Right.
You might come back in and work just 10% of your hours. And some employers, again, will give you full pay, even though you're only working 10%. It depends. If you have a union membership, they will support you with getting the best arrangement from that employer.
As you touched that, how important is a union?
That's the question. Well, I'm going to say that I think it is important.
It is.
Because it protects you as an employee in situations where you're vulnerable.
Can one person in the workplace join a union?
Most workplaces do allow you to join either a union that's recognised by the employer, or you can join a union that covers your range of employment.
Okay.
So there'll be sort of general unions that cover. Some workplaces don't allow unions.
Really?
Yeah.
Is that by law?
Is it legal? It probably is.
Really?
But then again, when you're signing the contract, you look at whether that's covered, and sometimes we don't have a choice. We just want a job. So we don't look at the sort of smaller print of.
I can honestly.
Yeah?
I can honestly agree. I don't look at my contract.
Yeah, well, I would encourage you because, as I say, it's a relationship. You're spending a lot of your working life there.
Yeah.
Read it carefully. it will sink in, and then later on you'll remember to look if something pops up that you think, let me just check that again.
Yeah, that was the last time I visited my contract to some extent. I didn't read all of it, but something happened at work, and I had to revisit it.
Yeah.
You know, to make sure I'm within my rights.
That's right.
You know, so the contract is really important.
Yeah, without a doubt, conflicts at work happens. You know, someone said to me just yesterday, "There's no such thing as a perfect job.
No.
There's no such thing." So anyway, I was saying, come back on 10% of your hours, and then gradually build up week by week. Add on, you know, a certain number of hours until you're full time. Now, if you feel you can't work full time, you can ask for part time. Again, some employers do not allow part time working. But we're talking about reasonable adjustments under the Equality Act, which is the act I told you, 2010. And what's reasonable is to be determined ultimately by an employment tribunal in the UK. This is like a court, but basically you sit in front of a magistrate and a small panel. Then it very rarely comes to that, because normally you just ask your employer, you involve your union, or you involve your solicitor if you want to take on a solicitor. Sometimes the citizens' advice, who are free of charge, will help you. And they will ask the employer to be reasonable. So if giving you a part-time role is not going to bankrupt the company, it's probably reasonable.
Right.
Giving you a job where you don't work nights is probably reasonable. It means, you know, they might have to bring in staff to cover your night shift. Right. But you might say, I can manage without that pay. You know, that pay enhancement. I will just work days. I'll work part-time. It sounds reasonable. And the employment tribunals usually go on the side of the employee, because the employee is the vulnerable person in that situation. If it's got to the point where you're at an employment tribunal, they tend to be supportive to the employee. I've sat in some. I've had to give evidence in some.
Okay.
Yeah, in the past.
Okay.
So build up your hours, adjust your duties. If you can no longer work in the cold room, for example, in a warehouse facility where there's a cold room, they can make an adjustment to put you somewhere where it's warmer. If you can no longer stand, they can give you a job that's sitting, potentially. They won't throw another person out of a job to accommodate the survivor, the cancer survivor, but they should be reasonable.
Okay.
Working from home is another one where it applies.
Okay. I work in a warehouse.
Yes.
Right? And you can expose to a lot of hazards.
Yes.
Right? Can you give us some advice on that?
Okay, so hazards, as I say, there's no perfect job. There's hazards in every job. Right. In a warehouse, it's one of the hazardous environments. There are shifts. The shift work, we know that shift work affects your well-being. We talked about nights and cancer a bit earlier, didn't we?
Yeah.
There's moving and handling. So that's lifting and carrying of items which are heavy.
Right.
There's legislation on that called the Moving and Handling Regulations, which outline the maximum that a healthy person can lift. If a person has cancer or some other condition, they cannot lift as much. They might have lymphedema in the arm, swelling. Right. They might have some pain in the back or chest or whatever, shortness of breath, fatigue. Right. So the moving and handling regulations, you want to give the risks.
Yeah, the risks.
So moving and handling, shift work, exposure to dust. It's very dusty sometimes. There's sometimes if somebody cut it and left that plastic strip. It's very strong. Somebody tripped over on that, and they tripped and they've got a really severe injury. Yeah. I think they were off work for 6 months with a fracture or something. It was bad. I think they got a head injury as well.
Really?
Yeah. So there's slips and trips and falls. There's chemicals as well, potentially. The things you're handling may be chemicals. There's so many. The stress. Yeah. Sometimes the demands of the job, the pace of the job that you are required to work at to get things out on time, to get things packaged, to get things labelled, to get all those things are demanding. And there's also repetitive work. You might be using a scanning gun over and over, and it can cause problems with the upper limb. Yeah. The wrist, the hand, the elbow, the shoulder, they can actually almost seize up in a sense, causing you inflammation in the tissues that can stop you from doing that job and stop you from working. Yeah. So that's among a few. I'm sure there's more. There's risks of biological agents sometimes, depending on what you're working with. So that's chemical, sort of things like you don't come across animals and stuff in a warehouse, but there may be some certain proteins
Yeah.
that you're exposed to that can cause asthma. So yeah, there's quite a few out there.
So
Noise,
as well.
noise, yeah.
Wow.
And working at height.
Uh,
You have those cherry pickers and you have those,
Yeah.
working at height and so forth, yeah.
So all those are hazards.
They're hazards because a hazard is a factor which can, with the level of risk not controlled, can lead to accidents and injuries.
Okay.
And even death.
Yeah.
And even death.
So as I was saying, I worked in a warehouse.
Yes.
And it's winter time. It's
Yes.
very, very cold. There are
Yes.
times you have to just take a 5 seconds and run into the canteen or a room that has heater, because in the warehouse do
Yes.
not have any heating system.
Yeah.
What kind of rights do we have around that?
Okay. Yeah, good question. So there is some more legislation. There's lots of legislation, and I haven't come across this one for a while, but it's to do with the work environment.
Mhm.
And there is actually a recommended lowest temperature that people can work at, which I think is 19 degrees.
90.
Yeah. So that's for an office type environment. It's not that warm. But if you're in a physical job, you're moving your joints, so your muscles, you tend to warm up. But if you are in more hazardous conditions, lower temperatures or hotter temperatures, they should provide you, your employer should do a risk assessment. They should look at the risk, how often is this happening? Who does it affect? Where is it happening? And they should make provisions by way of personal protective equipment. So that might be very high quality outerwear and even, underwear, body, insulation layers to protect you and keep you warm.
Mhm.
It's important that you stay hydrated as well and that you get rest breaks. So some employers put all those in place for their employees.
Right.
And again, that risk assessment and the measures that they put in place to protect the workers should be accessible to all the workers. It shouldn't be a secret. You shouldn't have to ask. It should be published. There should be training on it. They should make sure that you're educated to know what you have access to.
I'm really happy for this information because as it relates to my work, again, I can't speak for anyone else, but none of these has been placed for us. Like I said, you've been in the warehouse, you're working, you keep crying for cold, and you have to just take some time for yourself because obviously you can't keep working under that kind of temperature.
Yeah.
So you take a little second, 5 minutes or so, you
And
go
you might need
into
a
the
drink or
canteen,
something.
and you try and get some eating to come back.
Yeah,
and I don't think that is even too good for your health as well. Back and forth in the cold, heat, cold.
Yeah.
So,
There just seems to be some link to getting more infections.
right.
Moving from the cold to the heat all the time.
It's just sad that the Bible put it, by the sweat of your brow you have to eat bread.
Yeah,
So
true.
if you don't work, you can't get paid. And
That's right.
But I think employers should, put measures in place to make sure that, the employees are, comfortable and stuff.
Well, I'll be honest and say to you that if an employee or group of employees is not happy, they should speak to the employer.
Yeah.
And there should be forums where the employer lets them speak.
Right.
The employer then has the chance to make the changes. The union can be involved, so the union may represent one or more people, and they will also have a say. And the union will reiterate the rights of the employees.
Right.
And I think if people are actually getting sick, they can report to the Health and Safety Executive, which is a government body that basically tries to protect the worker. They put in place the laws that I've mentioned to you, and they will investigate. And they will potentially prosecute an employer if they're not fulfilling their duties. So let's say the risk assessment said you're meant to have a woolly hat, a pair of gloves, an insulation layer and a coat, let's just say. And yet they say, oh, we can't get the coats until next year. You have to, go to the shop and get your own coat or whatever. They could potentially be breaching their responsibilities. Just give you an example.
Okay.
The journey's never that quick, to try and get that resolved. It could still take 6 months.
Yeah.
But sometimes if people speak to each other, they're not happy, maybe they should approach the employer.
Okay. Thank you for that a lot. Depression.
Okay.
How, if I'm struggling with depression,
Mm-hmm.
how can I approach my employer
Okay.
about,
Okay.
my depression? And
Okay.
what steps and measures they, by law, have to take
Mm.
in assisting me with my depression?
So we do know, because I know we're a cancer podcast.
Yeah.
Blog. Depression can actually obviously come with cancer, not only to the person, the survivor,
Mm-hmm.
but also to their family and relatives.
Mm-hmm.
Depression is quite common, and sometimes it comes from within. You don't know why you've got it, but you've got it. Sometimes it's external factors that can trigger it.
Mm-hmm.
So we call it exogenous depression or endogenous from within. It's very common. Anxiety and depression are very common in our society. We talked about stress, and stress is one of those things that all of us are exposed to.
Yeah.
And some of us have different coping strategies, different coping levels. But depression is low mood, effectively. It's where your moods are low. It can affect you by way of loss of appetite, loss of concentration, loss of motivation.
Mm-hmm.
Sometimes your memory can be affected. Your sleep pattern can be affected.
Mm-hmm.
And appetite, I think I mentioned that, but your appetite can actually go up or go
I
down.
don't know.
It can get so bad that people feel that life is no longer worth living. They have no enjoyment in life, and they have thoughts that they want to commit suicide.
Right.
So it is recognised. It's a true diagnosis, and it's taken seriously.
Mm-hmm.
The only thing I will say is that, when you look at medicine, I'm a qualified medical doctor. When you finish medical school, you have a choice of what career in medicine you want to go into.
Right.
And I think there are 40, maybe even 60 different careers in medicine that a newly qualified doctor can pick up. Now, amongst those is psychiatry.
Mm-hmm.
And they're the people that treat depression at the highest level. Yeah.
Right.
Your GP can treat it, the counsellor can treat it,
Mm-hmm.
your friend can give you some support. But the highest level of knowledge is a psychiatrist.
Okay.
Now, psychiatry is not an attractive or appealing topic for young doctors to go into.
Someone said, as his friends, what can we do to help him to not feel so helpless sometimes?
As a what, sorry?
As his friends, how can we
Oh,
help him to feel less helpless?
that's a good question. Yeah, so thinking about the word friends, it's somebody that loves you, isn't it? Someone that cares for you.
Mm-hmm.
And if they see a change in your persona, how you're behaving, your moods, they can talk to you. Because sometimes just talking helps to lift that person's mood, that spirit.
Mm-hmm.
Yeah? Because sometimes a lot of us keep what's getting us down, we keep it inside us.
Right.
We don't want to burden other people with our woes.
Right.
But if we, and obviously prayer, we're Christians, we should pray to God, and He also uplifts us. The Holy Spirit encourages to take the right paths for our well-being.
Mm-hmm.
But as a friend, we meet a lot of people. You talked about the warehouse, and in the workplace, sometimes people are friends. Sometimes they're your enemies, aren't they?
Definitely.
And we won't go into that too much today. But your friend is the person that kind of looks at you, looks out for you. They're like a brother.
Mm-hmm.
I know you're an only child. But your friend can spend time with you, talking to you, take you out, even for a walk in the countryside, a walk in the park. Just seeing something green, it's found to actually lift your mental well-being. Spending time in green places. You found that, haven't you? And you're from Jamaica.
Yeah.
So you're used to beautiful green lushness.
Yeah, I've learned about that, especially when it comes to healing the body.
Yes.
One professional says it's a medicine when you go into the forest and you take your shoes off and you walk on that ground.
Yes.
It gives you that energy
That
to heal
feeling,
that body.
That's true.
Yeah.
God created it amongst these many creations.
I think it was not Dr. Barbara O'Neill.
Oh yes, Barbara O'Neill. We
Yeah.
spoke
Yeah.
about her ministry before, didn't we, briefly?
Yeah.
So that friend is a very important person to you. They lift you up when you're down. I spend time with you. They might have They may have some counselling qualities themselves just by listening to you as you talk, being there for you if you're having a down moment, responding to your requests for contact, text message, WhatsApp message, phone call. Those are things a friend can do. They can accompany you to appointments and stuff. So with depression then, it's fairly common. I probably do have some stats, but it's very common. And you asked me a question at the beginning, which was...
How could you approach work or work
yes.
can help you with...
Yeah, so you have to let them know.
Right.
I know a lot of people who are very private people. They don't want people to know what they're going through. They sometimes think others will see it as a point of weakness or vulnerability and play on it, So we keep it to ourselves to stay strong.
I can admit that I am one of those persons.
Yeah,
I'd rather to keep it to myself.
Yeah, that's right.
Especially when work is concerned.
Yeah.
I probably relate to a friend or a family, but where work is concerned, I not feel so confident with that. Maybe because of experience.
Okay. You need to let them know. Okay.
What is their duty to help?
Yeah, good question. So you've got a diagnosis from your doctor potentially, and just like the cancer patient, they can give you time to go to appointments, time to counselling. If you're on medication, which a lot of people don't like taking the medication, if you're on medication and it causes side effects, they can listen to what the side effects are and try and make adjustments.
Right.
So I have patients that say, well, the medication makes me drowsy, so I can't start work before 9:30.
Okay.
So instead of starting at 7, that might be starting at 9:30.
Okay. So is the employer have an obligation to make sure that happen, and will that staff, or by law, will that staff is obligated to get a normal pay?
Okay. Good questions, very good questions. It has to be deemed reasonable under the Equality Act. So as long as you're going to have those symptoms for more than a year, and those symptoms without treatment can have an adverse impact on your ability to do things like shopping, housework and travel. There are some people with depression who wouldn't be able to move from this sofa. No matter how hard they try, they find it almost impossible to even go and make something for themselves to drink.
I know someone.
Yeah. So that is affecting their ability to do normal activities, isn't it? And work, is like an extension of your normal activities. So the employer, it has to be reasonable. So there are so many jobs that we can take on. Warehouseman, the lollipop lady I mentioned.
Yeah.
If she can't start till 9:30, how are the kids going to cross the road at 8 o'clock? So is it reasonable for them to say, you can start at 9:30? You see, I'm giving you, a good example. So it has to be reasonable, and so then there's not an obligation. But what they have to do is document. Right. You would document that you put a request in writing. They send a response. They consider it, and then they put a response in writing. So it's not an ultimate obligation. They just have to be reasonable.
Doctor gave me, I think it's called sertraline.
Sertraline, 50 milligrams starting dose.
I honestly have the same pack.
You haven't
not
touched it?
Started.
Okay.
Because when I read the side effects, it makes me even more petrified of taking it.
Yeah. Okay.
So I haven't taken it, but at the same time, I am struggling with depression.
Okay.
And going to work, saying it to work is like, I don't want to say it to work because confidentiality.
Okay.
What advice would you give me as that person?
Okay. So well, first of all, you need to decide. Well, first of all, there are 3 strands to treating depression. One is exercise, and vigorous exercise, 45 minutes, I do 3 to 5 times a week. Exercise to the point where you're short of breath.
Right.
That is known to actually lift your mental well-being. If you can do it more, do it more. I told you I just came from the swimming pool this morning, and I try to exercise every day because, again, although it just helps your mental well-being.
Right.
And we found with any mental health condition, from schizophrenia to bipolar, depression, they're all helped by exercise. It's interesting, isn't it?
Interesting.
Because when you exercise, you release endorphins. They're the feel-good hormones.
Right.
But sertraline and other drugs are trying to mimic.
Okay.
So exercise is important. The other one is counselling or talking therapies. We talked about the friend helping you
Yeah.
or helping someone who's depressed. Now there are professionals who are trained up in it, but I honestly think sometimes a friend, because sometimes you have to wait 18 months to get a counsellor.
Trust me, especially
Yeah,
here.
And the reason is because there's so much depression out there.
Yeah.
And I was saying to you that psychiatry is one of those medical fields that you can take up as a young doctor,
Yeah.
but people are not being drawn to psychiatry as a choice.
Yeah.
Many of them are GPs, many want to become surgeons, heart specialists, and so on. But the job of a psychiatrist is a less appealing
Right.
medical speciality. So, so the third strand of treatment after exercise and talking therapies is actually the medication. And the thing about a psychiatrist is that if you are really at your worst, at your lowest point, and prayer and your friends and the exercise haven't helped you, the psychiatrist can actually recommend medication which will help. But they do have side effects. When you look at that list of side effects, I could say it's as long as your arm.
Definitely.
Yes? But not everyone gets the side effects. Not everyone gets the side effect. They have to list them again by law.
Yeah.
And but I know a lot of patients that are on it and they benefited. They put it off sometimes, but eventually they have to take it, and when they take it, they feel better for it.
I want to add to one of those three things.
Okay.
You can confirm if it can help. Deep breathing. Is that
That will help with anxiety,
okay?
and that will help with acute anxiety.
Okay.
And what that does again is it just we don't breathe, we don't use our lungs properly. Actually, we're always breathing from the top of our chest, and really every day, all of us should exercise some deep breathing. You're really filling your lungs, breathing in for 7 and breathing out for 11. Maybe we should get all the people on the podcast to give it a try and get the responses. Have we got 18 seconds to try that out?
I think I could try that as well.
Yeah.
Especially in the night before
Yeah.
going to bed.
Yeah.
Okay. So we spoke about fitness and work.
Yes.
Is this a government directive to get those who are suffering from cancer or other long-term illnesses back to work?
Yeah.
Is the system everly?
Yeah, it's a good one because
Sure.
there's an organisation known as Access to Work. This is an important one to know, access to work. I've mentioned the employer. We know about the employee who's got cancer. We know about the workplace and how they differ. We talked about reasonable adjustments. What is reasonable for your job for the employer to do? I've mentioned employment tribunals, which is the ultimate decision as to whether an employer has been reasonable or not. Because you see, if the employer has been unreasonable, and you said, help me, they can actually be, again, prosecuted in a way, or asked to give you compensation, or asked to give you your job back if you've left the job, or asked to give reasonable adjustments. Okay. Question again was, I mentioned the HSE, the Health and Safety Executive, who write out the legislation, publish it. And then there's an organisation called Access to Work. It's a Department for Work and Pension scheme. Money is fed into it by the government. And they're professionals who basically will visit your workplace. They'll look at adjustments that you need if you have a long-term condition. And they will they'll make recommendations for adjustments. And they will actually partly fund equipment that you might need. So let's say you need a special chair for your back or a sit-stand desk because you can't sit for long spells. They'll partly fund it and ask the employer to fund the rest.
Okay. All right. As we wind down, I have two important questions I would want to get into before we, close the podcast.
Yes.
And we mentioned about chemotherapy.
Yes.
And its side effects.
Yes.
And I've learned about comparing natural remedies with chemo.
Yeah.
What are your take on chemo, and what approach you think persons with cancer should take when it comes to these kind of treatments?
Again, that's a really good question. But cancer, as we know, is potentially fatal.
Definitely.
We talked about what cancer was.
Yeah.
And I kind of outlined to you that it starts off with a cell
Right.
that multiplies. It's a mutation.
Right.
It has no function in the body and it attacks other healthy cells.
Right.
Now, not only, let's say, the cancer is in the breast, let's say, it has the potential to spread in the bloodstream to other organs such as the lungs, the brain, the kidney, the bone. And you'll know from your mom's experience that
That's
is what we call
that's
secondary.
exactly where
It spreads to, and the liver.
And the liver.
And we call that metastasis or secondaries.
Right.
It is a potentially fatal condition.
Mm-hmm.
There are some very, very mild cancers sometimes affecting the bloodstream called lymphomas, chronic or leukemias, chronic lymphoblastic leukemia, for example.
Mm-hmm.
You can have it and it's very mild and you have it for a long time, but that's older people that get it.
Mm-hmm.
So with that in mind, bear in mind it's potentially fatal. And again, I'd say eat healthy, exercise, get sleep, drink water, speak to friends, manage the stress. But you must recognise that one of those 60 fields of medicine that I've described to you, I'm in occupational medicine, I'm also a GP. The field I'm thinking of, he's going to go for my brain now. My neighbour is one actually, but he's a cancer specialist.
Oh, okay.
He is. It's gone for me for a second, but it'll come back. You know, sometimes it's something at the tip of your tongue. I must mention, I have 36 years experience in medicine, and I did 6 years of medical school. So you know, I'm an old lady now. Sometimes I don't. What is it? Because I've actually got a family member who's a young doctor, and I do recommend this field to him as well.
Yeah.
He's a cancer specialist.
Right.
So I'm just going to highlight real quickly. There's two types of doctors, really. Yeah. So you've got physicians and you've got surgeons.
Right.
I'm a physician.
Right.
We treat with medication.
Yes.
And counselling and so forth. The other people are surgeons.
Mm-hmm.
They cut.
Right.
The simple math is they cut.
Right.
So they may not be even very good at talking to you, but when they find what it is they want to take out, they know what to do, where to go, what tools to use, and cut the thing out.
Definitely.
If they can. So my neighbour is a cancer specialist, and cancer is one of those areas that, a bit like Parkinson's disease, that this country has been very interested in. We have a number of charities that are investing, take investments. They're trying to look at how to improve treatment.
Right.
So the drugs that we have in this country for accessible now, I can imagine your mom didn't have that in Jamaica.
No, a lot of them.
They are pretty good. Yeah. In fact, what's happening is they can allow people to survive beyond 10 years and some beyond that. I did look up the survival stats and I have those to hand. But the survival statistics are actually pretty good. Okay. So more than 50% of people with any kind of cancer in this country will survive. 50% of them at least will survive 10 years. Right. And that's partly because of the cancer treatments, the chemotherapy. Now, this country is suffering some economic challenges. The NHS has suffered economic challenges, especially after COVID. But the drugs that treat cancer are very, very specially researched. They're expensive. And if you qualify to get this treatment, if I was to choose A or B, I'd say choose it. Because it's likely to extend life. You can take on those herbal remedies as well. We actually have evidence that some bush teas, by the way, can cause or contribute to liver cancer.
Really?
Yeah. So bear that in mind, that not all herbal remedies, depending on what dose you take, are safe.
It's interesting.
So just letting you know that's one of the things. Yeah.
That's interesting.
So they are full of antioxidants in the main. They're good for you, and I will always go back to basics that prevention is better than cure. While we still have that healthy body, look after it. You know, I've said water, sleep, rest, healthy diet, avoid stress, adequate, exercise as well, fresh air. So chemotherapy, I'd say, if you're offered it, go for it. The way we work here in the UK is that you must meet certain criteria before you qualify. Yeah, and one of those things will be to pick it up early. If you have any concerning symptoms, particularly if you see blood from anywhere, I'll tell you that blood is one of those things that you're not supposed to see unless you're menstruating or had a baby. If you're seeing blood, then you should speak to your doctor promptly, whether it's from your nose, from the penis, whether it's coming from your skin somewhere. If you see blood, speak to your doctor, because there's a chance, a risk there's cancer. Bear in mind that cancer is invading tissues. It's penetrating into blood vessels. It's causing blood vessels to become damaged. So, and if you've got pain or a swelling, or loss of weight, those things are signs that you might potentially have cancer. You must speak to your doctor, and don't give up. If you feel your doctor, your GP is not confident, not sure, go back, speak to a different doctor in the practice. And if you're in pain, you can go to A&E. So A&E, they deal with emergencies, but if you're in pain, and again, people don't like taking the paracetamol and stuff, but if you're in pain that seems not to be improving, think about cancer, you think that it's not going to go backwards, it's always going to get worse. So if you've got a pain that is persisting and persisting and persisting, don't just ignore it. So chemotherapy was your question, I think.
Chemotherapy.
The answer is yes. I think, was there another question after that? Sorry.
Natural
remedies, okay. So yeah, do what's right for your body naturally. There's so many chemicals and stuff. If you can eat whole grain food and natural food, or not so organic, but healthy food that you've prepared yourself, and avoid additives, you've got a better chance of protecting your body from the risk of developing cancer.
That's the part
And
I am
smoking,
on right now.
smoking and alcohol, and drugs.
That's the path I am on right now.
Good.
Trying to practice more healthy habits,
Yeah.
because having a mom that passed from
Yeah.
cancer,
Yeah.
and having family members, several family members
Yeah.
that have
Yeah.
had cancer,
Yeah.
I have to take that precaution with
Yeah.
my health,
Absolutely.
because if
This is my date of birth.
yeah,
I'm supposed to have a scan. Can you tell me where I am on the waiting list?
yeah,
They will generally answer the phone still, actually, because one thing I happened after COVID is people stopped answering their phone.
yeah,
But in those departments, they'll generally answer the phone and they'll look you up on the system
Yeah.
and say whether they have the referral, number one, because sometimes it hasn't been sent, and number two, where you are on the list,
okay.
and then three, how much longer you've got to wait.
So we'd have to
Chase
call
it,
the
I call it
hospital
chase it.
directly.
You can do, yeah. So, because if you've been told you're going to have an ultrasound scan of the abdomen,
Yeah.
you call it the ultrasound scan department
Okay.
between 9 and 5. So sometimes people don't work, they can't do that
Yeah.
when you lunch break.
Yeah.
And generally they'll answer the phone. So
Okay.
it's actually interesting.
Okay.
And the other thing about trying to get into your GPs, if you are really suffering, if you're suffering with mild to moderate symptoms and you can't get an appointment, you can ring 111, 111. They basically are a sort of an add-on. I work for them as well. I used to work for them, but I work for a similar organisation now as a GP. And they offer an add-on service where they can sometimes book an appointment with your GP for the next day. So if you rang today, Sunday, they will potentially book you into one of the slots that your GP has. That is purely for 111 to use, so that the next day the GP will call you. And although we're used to seeing GPs face to face in the past, I now am convinced that you don't have to see the GP.
Okay.
If you can describe the symptoms, pain in the upper left abdomen, ongoing for 6 weeks, associated with this, that, or the other, the GP wouldn't necessarily need to prod and poke you. Because when we prod and poke you, although we get an idea if something is really obviously wrong, we can't tell.
Yeah, because I don't feel any pain when you poke me.
Okay.
That's this thing, but the
Okay.
pain is there. Even though I'm sitting down
Yeah.
speaking to you,
Yeah.
the pain
Yeah.
is there.
Yeah.
But if you should touch there, I'm not going to feel
Pain,
it.
okay. So you
So
feel it at certain times.
It worries me.
Yeah.
So that's why I went to the GP.
Yeah.
But I'm still waiting for them to,
Yeah.
get that scan done.
Yeah. So if they sent the form off, it should be with the ultrasound scan department.
Yeah.
Sometimes you don't know what kind of scan you're due to get.
Right.
So 111, they can sometimes get you an appointment. Ring the ultrasound scan department, ask them where your referral is.
Okay.
And I can look you up on the system. And is there anything else I need to advise you? I sometimes lose track of what the question was.
Yeah, it was about what was it again? Yeah.
You mentioned about the pain.
Yeah, the pain that
Yeah.
I'm feeling,
Yeah.
and the GP, the waiting time,
Yeah.
etc.
That will
So
help you.
basically-
I recognise the GPs vary across the country, so
All right. So as we close, the last question I want to ask you
mhm.
is, you list a few things about health and fitness
Yes.
and work.
Yes.
Is there a website that you could direct the listeners to, so where they could find these information to
That's a good
help,
question.
check
Good
on
question.
yourself?
Well, interesting enough, in the UK, there are so many charities covering so many illnesses.
Mm-hmm.
Breast cancer,
Mm-hmm.
mental health.
Mm-hmm.
There's so many. So if you can go to Google
Mm-hmm.
or your search engine, and you look up, before Google, we used to have a lot of other search engines, but they've all gone. So I'll say Google, and you put in what it is you want advice on.
Mm-hmm.
You can put in breast cancer and work, and there'll be somebody who's published a document, a guide for employees and a guide for employers.
Mm-hmm.
The other one is the NHS website. So if you put in NHS and you put the condition, the NHS website gives you information on anything you need to know about every single health condition out there. But in terms of fitness for work, the charities tended to produce guidance as well for employers and employees.
Someone asked, what's the best medication for epilepsy?
Okay, good question. Epilepsy is treated by a neurologist. It has to be diagnosed. It is the tendency to seizures. There are a number of medications out there. Epilim is one of them. Sodium valproate is another. I can't say one is better than the other. They have side effects. And what will happen is the neurologist, the specialist doctor, one of those 60 specialists that I described, can actually recommend starting off on a low dose to see if it controls the epileptic seizures. And again, I had a patient just a couple of weeks ago that was in this position, and they have to gradually increase the dose, or sometimes add a second drug, depending on how severe the epilepsy is, to actually get the seizures under control. So there's no specific treatment I can say over the podcast that is right for that person, but their doctor, their specialist, will help them get onto the right treatment.
Okay. All right.
Any other questions?
Any other questions from the audience? She had epilepsy for 20 years, and every time they give me the medication, it's not working.
Okay. So that's a neurologist. The day she's referring to is a neurologist. This is not generally ever given out by the GP. It's not initially prescribed by the GP.
She have to visit a neurologist.
Yeah, she's under a neurologist, I suspect, if she's in the UK.
Yeah, she's in the UK.
And they basically will titrate, we call it titrate, build the dose up to the point where hopefully the seizures are under control. So although she may still be getting seizures, they may not be as frequent or as severe as they once were.
Mm-hmm.
But epilepsy is a serious condition, yes.
What I've learned about epilepsy was you can also control epilepsy. You can back that up if you know.
Mm-hmm.
What I've learned about epilepsy, you can control epilepsy through your diet as well. Is that
alcohol is one thing you should avoid. You must recognise there's actually an abnormality of the brain waves.
Oh, really?
Yes.
I
That's
didn't
why
know
they
that.
do what's called an EEG or electroencephalogram to diagnose it.
Oh.
And what that picks up on is certain brain waves that basically can then spike and lead to a seizure.
Oh.
And people have died with it. Sometimes they've died in the bar, for example.
Yeah, I know.
Sometimes they've fallen and injured themselves alone. Yeah. So, another question?
Would you say stress adds to it?
Yes.
Okay.
Yeah. Because when you must get plenty of sleep and stay well hydrated, avoid alcohol, and stress is one of those factors that it stops you sleeping well, puts you on edge, and when you're like that, it can actually obviously increase those brain waves and lead to seizures. Any other questions?
All right. So I've watched this podcast,
Okay.
Diary of a CEO,
Okay. Interesting.
and at the end of his podcast, he would ask his guest, to leave a question for the
Okay.
coming guests.
Okay.
And I have been inspired to, do something like that.
Okay.
But this is because this podcast is about cancer and health.
Yes.
I'm not going to ask you to leave any question for the guests.
Mhm.
However, I'm going to ask you to leave an encouraging word for the next guest that's coming. However, that your answer would be off air,
Oh,
so that they won't hear before. So I will ask you that question after
okay.
you could
Okay.
answer. All right. Dr. Jackie Holliday Bell, I really do appreciate you coming through and giving us some very insightful knowledge of work, health, and cancer and fitness. I'm sure everyone learned a lot from this, including myself.
Yeah.
And I really do appreciate you passing through.
Can I just add one more point?
Sure.
One thing I will say is if you are in a job and you're paying into a pension
Mhm.
and you are not fit to work because of the cancer,
Mhm.
you may well be entitled to ill health early retirement.
Oh.
So what happens, you don't just resign,
Mm-hmm.
you apply for ill health early retirement and they will boost your pension. So that when you do leave,
Mhm.
you've not only got your pension, you've got a boosted pension. Sometimes, depending on what scheme you're in,
Mhm.
you will therefore have more money to live on. Because when you leave that job, obviously your income is going to drop.
Oh.
So whatever you do, along with reading that contract,
Mhm.
look at your pension entitlement because if you have to leave because of cancer or any other chronic condition,
Mhm.
please ask your employer to look at the ill health early retirement for you.
Yeah.
Don't just resign and walk away.
Mhm.
You're probably walking away from money that you're entitled to.
That's
And
good.
just yesterday at church, I met two people who admitted that they just resigned
Whoa.
and they would have probably been entitled. And you got that sick pay, so you take the sick pay first if you can.
Mhm.
And then if you're not getting better, you ask the employer, please, to consider ill health early retirement.
That's a really
Sorry,
good
yeah, sorry to
information.
that, yeah, because that was one of my,
That's really good
Important
because I've learned as well that
Yeah.
when you, especially when you have cancer, your medications are free in the UK.
yes, they are.
Okay.
You don't pay.
Thank
Sorry.
you for that.
Sorry.
That's very, very interesting. Thank you for that. All right, thank you guys for joining the live, and I hope you all learned a lot. And as you know, that this podcast will be posted on the YouTube channel Ivy Cancer Podcast. So if you join the live late, you can always visit Ivy Cancer Podcast on YouTube. And also, please guys, subscribe to the YouTube channel because the YouTube channel was created for a charity purpose and to also help spread cancer awareness. So please subscribe to the YouTube channel, give a like, share and leave a comment. Thank you. See you next week. You want to pray?
Yeah, let's both pray.
Uh,
I'll pray first. Dear God our Father, thank you for this opportunity to take part in a podcast, Lord. You've given us this wonderful human body, you've given us this wonderful world. And yet times, Lord, we face illnesses sometimes through the way we live our lives. I pray, Lord, that this podcast will be helpful to people who want to understand more about how they can improve their health and improve the health of their loved ones. And to try and take the right path, Lord, because you intended for us to have good in our lives and not evil. Be with us as we present this podcast to people who are listening, and may it be a blessing to them and their loved ones, I pray. Amen.
Oh, dear righteous and eternal Father, we just want to give you thanks one more time, dear God, for the many blessings that you have bestowed upon us. We ask that whatever sins that we have committed, we ask that you may forgive us. And I pray, that, Father, for Dr. J and her family, that you may continue to bless them, continue to uplift them, continue to cover them, dear Father. I pray for those who have listened to this podcast, may be blessed through this ministry. I pray that you may bless the listeners so that they could, learn something from this. I pray that you may, spread this podcast and let it be a successful one in Jesus' name.
Amen.
Amen.